Hi, my name is Tavis Piatoli, sports dietitian with the Taylor Hooten Foundation, and this is my talk on appearance and performance enhancing substances in high-risk supplements. My only conflict of interest is I am on the scientific advisory board for the company Nordic Naturals, which is a fish oil company, and I will be discussing omega-3 during this presentation. Before we get started, I want to give you a little bit of an overview of our organization. Like a lot of young athletes today, they're looking for ways to get bigger, stronger, and faster, and that was Taylor. Taylor was really just looking for ways to get better as an athlete, and then realized he had to approach his coach and get some advice. He wanted to make the varsity squad and wanted to know what he had to do to be a better athlete, to be the number one pitcher and make the squad. And his coach basically informed him that you have to get as big and strong as possible. And that is very common in today's athletics. Athletes are looking for ways to get bigger, stronger, and faster. Without having those resources, he sought those resources through his teammates and realized that half his teammates were using anabolic steroids, so he made the uneducated decision to do the same thing. And by doing so, we saw his family saw significant changes in his mood, his behavior, his size, and it was really questioning what was going on and thought Taylor was using drugs, and brought Taylor into a pediatrician, tested negative for drugs because they were not testing for steroids. And then unfortunately that same behavior continued. 6 months later, Taylor agreed to see a psychologist, and after 6 sessions with that psychologist, he finally admitted to what was going on. And by doing so, that psychologist asked him to quit. That changed, obviously, a lot of things that had the opposite effect that we will discuss today, and eventually led to Taylor's suicide. So our mission as an organization is to make sure we get in front of our youth, our adult influencers, and talk about the risk. These are drugs that are not talked about often enough. They're kind of hidden in plain sight, and we don't really address the situation before it happens. We are very fortunate to have partners that allow us to bring our programs all across the country, as well as working with different organizations like the NATA and different athletic training associations. So honored to be presenting to you guys today. As we go through this topic today, we're going to not just focus on steroids, we're going to go through dietary supplements as well. That is a big risk with certain athletes. We'll talk about energy drinks. We'll also introduce a topic called SARMs, which you may have heard of already, and then go into anabolic steroids. So let's get started on dietary supplements. Everybody knows what dietary supplements are, supplements in general. We know there is a lack of regulation. There is regulation. Now, a lot of people think there is no regulation, but there is some regulation by the FDA on these ingredients. It usually takes a lot before someone steps in and does anything, but at the same time, there is regulation when it comes to dietary supplements. And this is anything from protein shakes, creatine, energy drinks, anything you purchase online, this is considered a dietary supplement. When we look at the market of dietary supplements, it's a big, big market. There's over 50,000 supplements. Just in, I think, 2017, $37 billion in sales. And these are individuals that they target vulnerable individuals by making false claims. These are not illegal claims, they're just false, such as a reduction in body fat, increased strength, boosted energy. When I look at this picture, and I'm sure when most people walk into a place like this, especially a young athlete, they're going to feel some sort of intimidation because there's so much to look for, so many products. Unless they know what they're walking into to buy, it's going to be difficult to find a product they feel is going to be effective, but also is it going to be safe, and we'll talk about that. Here's just kind of a view of the global sports supplement projections. As in 2018, this is all products combined, $50 billion. And, we know the NFL is a big organization. They bring in $14 billion a year. But by the year 2023, sports supplements are going to bring in $81 billion. Where does a lot of that come from? Still popular today, protein powders, sports drinks, some from energy bars, some from sports protein bars, also ready to drink, and also non-protein products as well. So a lot of growth still in the protein powder market and in the sports drink market. We've seen new sports drink companies come out and start to capture some of that market as well. So the problem begins kind of at a young age. We start kind of grooming our kids pretty young. Now, I have a 9-year-old daughter. I've been giving her liquid fish oil since she was 3 months old. There are benefits. There are certain supplements that have science to support using them. We do know there are over 12 million middle and high school students using some sort of supplement, whether that's protein or some other muscle building supplements. And data tells us that over 60% of college athletes are using supplements. Now, why do young athletes use supplements? Well, there's a lot of different reasons. There's poor eating habits. That's really, I think, the common reason why, because they're not getting their goals. Infrequent eating patterns, skipping meals, constant calorie deficit makes them think something is not working, when in reality, it's their diet. All of this can be achieved through healthy diet, good training programs, and smart supplementation. There's also athlete influence. There's brands affiliated with athletes that make these young athletes think that what they're taking is why they're accomplishing success on the field. And also excessive activity combined with poor eating habits, prevents them from reaching those goals. They're looking for ways to get bigger, stronger, faster. And excess activity combined with calorie deficit usually leads to weight loss and muscle loss. So we're feeling that there's something they need to take to solve that problem. Also, there's pressure to win. In certain places, there's a lot of pressure to be successful in sports. Some of these kids want to get to the next level. They want to gain a competitive edge, and we talked about getting bigger, stronger, faster. There's also peer pressure from teammates, and as we go through the steroid chapter, we're going to talk about appearance a lot, and it's not just always athletic performance, but it may be associated with the way we look and feel. Now, in some research that we've done in the past, in gathering in some of my work early on, really going out and surveying high school athletes, we looked at why, what was the reason for taking, and 60% of those kids wanted to improve strength. Then we allowed them to circle any answer. So we had 50% muscle mass, 50% athletic performance. Some of them wanted to change the way they look and feel and also decrease body fat. But it was really that if you look at this, it's bigger and stronger and faster. It's strength, muscle mass, athletic performance. Who were influential and some of the reasons for these individuals for taking? Their parents, so there was some parent pressure in driving this. Coaches, teammates, friends. Maybe it was a nutritionist or dietitian they were working with. Maybe it was a physician. So you can see here the different individuals that had the influence on them for taking those supplements. Now, my concern with the young athlete with supplements is just their knowledge base is not very good. This study looked at high school athletes taking protein supplements, and what the outcome was they had a greater misconception of use versus non-protein supplement users. They thought, using a protein supplement indicated adding protein was required to gain as much as possible. And the info where they got that from were from coaches, parents, and their friends. Also, what concerns me is the lack of knowledge of the people that work in supplement education or supplement store staff. They truly lack medical and science and nutrition education. They're often focused on making a sale. And few of these individuals understand the science behind the ingredients. What is the dosage? What is an effective raw material? Where does that raw material come from? But finally, few are very familiar with third-party testing, certifications, and supplement safety. I've had numerous athletes at the professional level, at the collegiate level, test positive for banned substances of things that they have purchased from the supplement store. Here's a great study that kind of determines that lack of education from these individuals. Looking at a study by McGuire Harriman, he basically posed as a 15-year-old high school athlete, called over 244 health food stores. And really the interesting result here was that 41.8%, that bottom marker under results, would have allowed for them to buy a testosterone booster if they were in the store. 9.8% recommended a testosterone booster over the phone. So these were all phone contacts. Very interesting to see. And the author advised the supplement store staff that he was trying to gain as much weight as possible. So we talked about early on the lack of regulation. So this kind of question goes, are dietary supplements regulated? I kind of gave you the answer already, but there is regulation. Yes, there is some regulation. Manufacturers actually are able to make claims of performance that are not necessarily backed up by reliable science. This is not illegal. You can't make claims to prevent, cure, or treat a disease, but you can make claims even if it has one study that shows a benefit and just maybe 3 or 4 individuals, and 50 other studies show no benefit. So that's exactly what they are allowed to do. The manufacturers do not need to register their products with the FDA, nor get FDA approval before producing or selling dietary supplements. So unless you have a new ingredient that's never been approved in the market, you don't have to have FDA approval. And that's the shady things with these players. There's individuals out there that do a phenomenal job of going through all the testing, all the facility certifications that they need, all the handling processes, cross-contamination testing, and testing. And there's other players that make this out of their house, or they allow banned substances in their facility. So it's extremely it's a very Russian roulette-based industry, and we have to be very cautious. So you wonder, where do these raw materials come from? How do supplements get banned, or how do they get banned substances in the product? Well, raw materials come from different places: U.S., China, Europe. That they're the raw material suppliers. Supplement manufacturer gets those products from the raw material supplier that they purchase, and eventually that goes into the supplement for the supplement company, depending on what that supplement company wants. Now, let's look at how does a supplement get adulterated. Well, you have two things. You have deliberate. You have the intention to use a banned substance in the product, and that's determined by the actual supplement company. They might tell the manufacturing facility what they want. Now, if that manufacturing facility is not an NSF certified manufacturing facility for banned substances and for certified GMP, then they're going to carry what they want. In some cases, it's not illegal to carry banned substances, but it is illegal to carry illegal substances. Things like ephedra, DMAA are actually banned by the FDA. So there's a big difference between a banned substance in sport and an illegal substance from the FDA. Now, cross-contamination happens where if you are a supplement company and you are looking for a manufacturer to manufacture your products, and let's say you would like a protein powder, and you don't want any banned substances in it, you want a good, clean product, but the company that used the machines before you actually put in a banned substance in their pre-workout. It might be synephrine, which we'll talk about. Synephrine is banned by all sporting agencies. Well, if they don't clean those machines well, and there's still some synephrine left on the mixing containers or inside the machines, and you run your protein powder, it could get cross-contaminated with that raw material. So that's kind of how these things happen. So 3 questions we recommend you ask, especially your athletes ask before they take supplements. Is it clean? And substance. And what's, is this product going to solve a problem? Is it going to provide an answer to those individuals to help them solve that problem? We know 18 to 25% of supplements have been tested positive for steroids. That's a big number. Informed Choice did a really good evaluation when they walked into supplement stores, pulled 58 protein powders off the shelf, and 25% tested positive for banned substances. So a lot of data that shows we have to be cautious when it comes to the supplement industry, especially if we are getting tested for banned substances at the collegiate, professional, and Olympic level. This is just a list. You guys know the list of banned substances. In high school, they don't test, so it's not something that you're looking at on a regular basis. If you're a collegiate or professional athletic trainer, it's a different story. Obviously, we're being a lot more cautious and trying to educate our athletes on this. So the question we have to look at is how many of you are doping and don't know it? Not you guys in general, but just athletes in general. Are they doping based on what they don't know what's on the label? Here's kind of an example. Our athletes are marketed to all the time. This is a Facebook ad for a pro steroid. If you can look here, the first compound is a steroid, the one androstenedione 3-17-1, and then they use a grapefruit extract compound to enhance the steroid uptake. So this is marketed. This High-Tech Pharmaceuticals is a company that has been known to use a lot of illegal ingredients in their products. We'll show you a product later coming up. On another product they manufacture that has a banned substance and an illegal substance as well. So first thing I want to talk about is really protein. This is one of the most common and highest supplement used by athletes. Protein is used by more athletes than any other supplement. And that doesn't mean it's a bad thing. I think there's a lot of myths about protein. Number one, the myth, heavy use of protein powders in young athletes. They think it helps them gain weight. They think they use it as a meal replacement, or they use it a lot as a meal replacement, or think it's really beneficial, or they feel it's best used after a workout for repair and rebuilding. And there are some truths to that. But really where protein is beneficial, it does improve muscle recovery, it does repair and rebuild muscle tissue, and there's a slight metabolism boost when you consume a good amount of protein. At the same time, we've seen in the research, more is not better. Consuming excessive amounts is not going to lead to more muscle gain. And research by Luke Van Loon, research by Stu Phillips has demonstrated additional protein has no additional benefit on muscle gain or size. So yeah, it does add extra calories, but we need to have a combination of calories from carbohydrates and fat as well. We need about 80% of our body weight. That is really where the science looks to be. Are we looking at 1.6 to 1.8 grams per kg? It's really about 0.8 grams per pound of body weight. No more than 1 gram per pound is needed to accomplish that goal. In some cases, those athletes who need, let's say, 4, 5, 6,000 calories, we may need to supplement with some powder, and we may need to make smoothies before bed, after a workout. There are places where that's beneficial. We just don't want them relying on that all day, every day as a resource. For my athletes that's trying to gain weight and build muscle, then absolutely, if they need 4,000 and 5,000 calories, I have smoothie recipes for them for breakfast. I'm recommending they consume a high-calorie smoothie or a high-calorie meal before bed as well, so they're not going to bed in a calorie deficit. One of the biggest things that has the biggest concern for me are energy drinks. Energy drinks, stimulant-based, but what we do know is it's the combination of these ingredients that really cause the biggest issue. We know a lot of individuals are using energy drinks, but the big concern here is not just the fact that it has caffeine, but there are other ingredients associated, with these ingredients that can cause an electrical disturbance in the heart. Here's kind of an overview of what that looks like in regards to the different products and the caffeine concentration per milligram of fluid ounce. And you can see here 5 Hour Energy, because it's small, and these little small shooters, they're going to have the most caffeine packed in the smallest serving. That doesn't mean they're more dangerous. It just means they have the more caffeine per fluid ounce. So you're getting quicker caffeine absorbed into the body at a quicker level, as opposed to if you're sipping coffee or drinking a drink and not consuming it all at once. If we look at trends in energy drinks, we've seen kind of the biggest increase in young adults. And that's kind of what's pretty common right now is those 18-year-olds, 19, 20-year-olds. That's where we're kind of seeing some pretty significant increases, even in that 16 to 17-year-old population, consuming a pretty good bit, throughout the day. Overall, the highest intake is in male Caucasians with a high school diploma or less. So, hate to say it this way, but it's not the most educated people that are drinking energy drinks. What we do know is just one energy drink a day may hurt blood vessel function. This is research by Dr. John Higgins' lab. He's looked at the fact that just one a day could impact blood vessel function by 20%. That's quite significant. And the research he did was in healthy medical students. So what's really interesting about this is Dr. Higgins doesn't know the cause yet. They're still looking at why this could have happened. It could be a combination of things. It's not the caffeine in our discussions with him, but there are other factors that they're still exploring to see why this happened. Now, when we look at the mechanisms for energy drink consumption and possibly sudden cardiac death, this is a vulnerable population we start with, and then high energy drink, high caffeine, other substances that may be in those products that reduces myocardial supply and increased demand. Increases their risk for ischemia, and then eventually ventricular arrhythmia and sudden cardiac death could possibly happen, especially when we look at use over time. All the different effects, we see all the acute effects, and we're not going to break down all of these, but as athletic trainers, these side effects, the potential risk, especially if young athletes are consuming several of these and then going to intense exercise. That is a potential risk for a really bad situation that we don't ever want to happen. When we look at certain energy drinks that have banned substances, these are two examples. Guarana. We kind of overlook guarana seed. Now, and I'm not going to sit here and say guarana is harmful, but if you look at the ingredient of Celsius on the left, it's got 3 different stimulants. Guarana extract, it's got caffeine, it's also got green tea leaf extract. Now, again, all of these can be used and safe, but we don't know what the breakdown is. It's got 1.81 grams, and it's all broken down into a proprietary blend, but we just don't know how much caffeine's in it. Usually the first ingredient has the most, so taurine probably has the highest amount, then guarana, then caffeine, and then finally green tea, but they don't break it down. If a college athlete was to use this product, they would test positive. Same thing for NOS. This also has guarana seed, and it would cause them to test positive and lose some eligibility. What we got to look at is just What's the risk? If you want some caffeine, hey, drink some coffee. Coffee's perfect. It's gonna give you 200, 300 milligrams of caffeine, depending on where you get that from. From energy drinks, there's caffeine plus all these other stimulants that could cause an issue, especially an electrical disturbance. And we have to look at some of these shady players that are putting ingredients in there that shouldn't be in those products. Same thing with weight loss supplements. This is another category that is concerning to me. Several thousand on the market. There are individuals, and it's the opposite of the weight gain, the get bigger, stronger group. It's the fat loss, lose weight group that are looking for ways to cut quickly. It could be the wrestler that needs to cut weight quickly. It could be those weight controlled sports. It could be the gymnastics athlete that's told by their coach that they're too heavy, or the dancer. And it could be the female athlete, it could be the male athlete. Both sides are looking for ways to change their physique and do it quickly. A lot of these ingredients are basically energy drinks in a capsule form. Guarana seed, bitter orange, these are all banned substances. DMA, DMBA, synephrine, these are all different powerful stimulants that we have to be concerned about that are ending up in weight loss supplements, which increase core temperature, increase risk of stroke. And when you're looking at a very intense exercise environment, it could be a recipe for disaster. Here's an example. We talked about high-tech pharmaceuticals earlier. This is one of their weight loss products. As you can see, the Ultimate Diet and Energy Aid developed for hardcore athletes, but it contains 8 different stimulants and 4 banned substances, and one of those is illegal. Ephedra extract is banned. It's illegal. It's an illegal supplement. It should not be used in this product, but they are doing everything they can to this is a very high potent stimulant that can cause probably some significant side effects, especially on the cardiovascular system. All right, look at weight loss supplements. Again, this is a multi-level marketing type brand, but the bottom is a banned substance, synephrine, that is also a banned substance, and DMHA, known as Octadrene, is also a banned substance as well. So you can kind of see how companies are using banned substances. They probably don't even realize this is a banned substance because the market they're going after are overweight adults. They're not athletes. Pre-workouts are basically powdered energy. This is probably an area that has concerned a lot of you guys as athletic trainers over the years, because you've probably come across your athletes using pre-workouts. Now, I'm not going to sit here and bash every pre-workout and say everyone is dangerous and every pre-workout's going to cause a fatal event, but we just have to really explore the purpose, why athletes are using these. Are they skipping meals? Are they not getting enough sleep? How can we solve that problem without spending $40 or $50 on something that could cause a problem? What a lot of these ingredients or products are just low doses of maybe creatine, arginine, which is useless, branch chains, useless. They put a lot of beta-alanine, which causes the tingling of the skin, but it's ineffective in these high bolus doses. And then they put a lot of caffeine, and they put other stimulants in there. Some of these products may have stimulants like synephrine or DMBA or DMA, which are amphetamine-like compounds. It's not a lot of the companies out there, but there are some that do put these in their products. There's a lot more that will have synephrine, which is not illegal, but it's banned for sport. And we have to just be concerned about why would a 14, 15, 16-year-old kid be taking these. The risk and concern with those individuals is more is better. So it's not just one scoop. I had a high school athlete years ago when I was speaking at a high school. He was on the powerlifting team. He was taking 6 scoops of Jack 3D when it had DMAA, 6. And he was really, he's like, it felt like my heart was jumping out of my chest. That's the mentality we deal with, and then it leads to those potential side effects same side effects we saw with energy drinks. We would see a lot of those same side effects probably here as well. Here's an example. C4, probably one of the most popular products in the market when it comes to pre-workouts, but this is kind of a previous formula, but still very similar to today. A lot of beta-alanine, well, I say a lot, 1.6 grams, creatine nitrate, will not have an effect at that dose. And arginine, you don't want to take before you work out anyway, because it could blunt growth hormone. And all they do here is basically put 250 milligrams of caffeine and advertise it as an explosive energy blend. Here's an example of a pre-workout that contains the banned substance bitter orange, also known as citrus aurantium, also known as synephrine. So I'm going to take you through a few slides here that'll kind of break down and show you on the label how someone can use different names for that same banned substance. So here's a pre-workout, a lot of different ingredients. Again, beta-alanine, arginine, taurine, all caffeine, 300 milligrams, but another stimulant. In this product, it's known as bitter orange or 30% synephrine. So another pre-workout, similar ingredient profile. They also use dendrobium, which is also another banned substance, but I wanted to kind of point this one out right on the label. And then this is an example of a company that actually uses four stimulants. I'm just going to highlight a couple, but synephrine is the banned substance here at the bottom. Then they have guarana seed extract, which is circled, caffeine anhydrous, and if you look on the bottom line, coffee bean extract, kola nut extract. So several different stimulants, but the thing here is the proprietary blend. A lot of ingredients, 10 grams, almost 11 grams. The first three ingredients they actually are transparent about: 3.12 grams of D-aspartic acid, 2 grams of L-carnitine, and 1 gram of creatine nitrate. That leaves another 4.76 grams or 4 grams for the rest, and we don't know how those are broken down. And that's what these companies do. And they put a hefty price tag of $75 on something that cost about $4 to make. I want to move into not a new drug, but a fairly new drug that's marketed as a supplement. It's been around a while, but selective androgen receptor modulators, also known as SARMs, is a very popular drug that's being used by a lot of young athletes as a safer alternative to testosterone or safer alternative to steroids. These are synthetic drugs designed to have similar effects as testosterone. They also are known as androgen receptor ligands. They share similar anabolic pathways with steroidal androgens. They're sold in products marketed as dietary supplements. We've seen athletes test positive for these. I had an athletic director at a D1 college, after I spoke there, basically pulled me aside and he said, hey, we had 2 football players test positive for SARMs that were found in their weight gain powder. So these things are popping up in a lot of different places. We have to be extremely cautious and concerned. They are illegal in any type of dietary supplement. They're also marketed as legal steroids or steroid alternatives. They are prohibited for the use in sport, so every sport has them listed as a banned substance, but there are 300 products on the market that contain SARMs, maybe more than that now. And there is a lot of interest in the medical community to look at research. There's been research that looks at muscle wasting conditions like cancer, HIV, and AIDS. So it is a risk. I definitely recommend you also check out our All Me podcast. I did a interview with Dr. James Dalton at the University of Michigan, who heads their pharmacy department, and we talked a lot about SARMs and his research over the last 15 to 20 years, looking at the safety, but also discussing whether or not this would be a safe alternative to steroids. So definitely check out that on our All Me podcast for the Taylor Hooten Foundation. This just gives you a list of the different types of SARMs, kind of gives you an idea of what they're going to look like. So if you are in, your athletic training room and you see anything that looks like this, you want to definitely take a closer look, because it might look like something they're taking for treatment, and it might look like an eye drop or an ear drop or anything, and those athletes might try to hide what it is. And it's not uncommon today for young athletes to be using a lot of these. So these are different types of SARMs that are used in today's society. I do want to take you guys now through some slides that are of extreme benefit that I feel from a supplementation standpoint may have some benefit for athletes, but have been in the science, or at least in the media, have been deemed as potentially harmful. So I want to talk about creatine first. So everybody knows here what creatine is, synthesized from methionine, arginine, and glycine. So these are 3 amino acids. We can get these from food, but also the remainder of creatine synthesized, usually found in our diet. So salmon, beef, we'll talk about that in the next slide. 2/3 of this is found in the muscle as phosphocreatine, 5% in the brain and testes, and the rest circulates as free creatine. So we have a muscle pool of creatine. It's just like anything else. You have a big pool. You throw creatine in that pool, the muscle creatine plus the free creatine. It's about 120 grams for a 70-kilogram male athlete. The body has the capacity to store about 160 grams under certain conditions of stress, wasting, trauma, HIV, and only 1 to 2% of that is broken down into creatinine and excreted in the urine, about 2 grams per day turnover rate. So a lot of this is going to be stored in the body and used. Now, when we look at food, you'd have to consume a really good bit of food to get adequate creatine stores. You'd have to consume, anywhere from a pound. You'd get 3 to 4 grams of creatine per pound of herring, 2 grams for a 16-ounce piece of pork. You'd have to eat a 16-ounce steak just to get 2 grams. So you'd have to consume a good bit of food to get some creatine in your body. Not always the best way to do that unless you spread this out throughout the day. What is creatine, or just creatine monohydrate? The benefits really of creatine supplementation, there's a lot. I mean, it's a very versatile nutrient. We're going to just talk about athletic performance today. We'll talk about some studies, but really increasing phosphocreatine availability to working muscle, because when we're training at a high level, we're sprinting, we're lifting, we're using our phosphocreatine stores, we're exhausting our creatine availability. There's repeated bouts of intense activity, that explosive power. So when we consume creatine supplementation, not only does it repair and replace this, but it also can promote the maintenance of glycogen when combined with carbohydrate. Especially, after a workout, if you add carbohydrate to your creatine, this is a great place to consume this. It gives you greater training tolerance, and also research has shown an increase in work capacity. When we look at the side effects of creatine, the only clinical side effect that has been reported or demonstrated in the research has been weight gain. And that always seems to be puzzling for some individuals, because they're like, there's just no way. There's got to be a lot more, based on what they've heard, based on what they've read, based on what they've been told. There have been some case studies that have shown maybe effects on kidney function, maybe effects. And a lot of this has been due to overuse and excessive use, or it's due to another cause, maybe rhabdomyolysis from excessive training, but blamed on creatine. There have been cases of diarrhea if you take in large dosages, and a lot of anecdotal side effects, as you see here, from dehydration, muscle cramping, increased risk of musculoskeletal injuries, GI distress, renal stress, liver function, restlessness. Also just did a podcast with Dr. Rick Kreider from Texas A&M. He is kind of the researcher on creatine. He's done over 25 years of research examining creatine. He's got a book on creatine. I highly recommend, again, you check out our podcast on creatine supplementation with Dr. Kreider. A lot of great information we discuss along this, and what happens, especially if you take too much. When we look at the research and safety, over 48,000 studies on creatine. So this is not just a supplement that is looking at exercise performance. There's been a lot that's looked at exercise performance, but a lot of other studies are looking at other disease states: Lou Gehrig's disease, muscular dystrophy, spinal cord injuries. For our ATs, there's a lot of work that has been published on creatine for TBI, because it crosses the blood-brain barrier. It's stored in the brain. So there is some benefit when we look at concussion on administering creatine supplementation, as well as some other things we'll discuss today. Benefits in clinical populations, we kind of just discussed a few of those, but fibromyalgia as well, Huntington's disease, COPD, Parkinson's, psychiatric disorders, concussion treatment, as we just talked about. And then children with inborn errors of creatine metabolism, kids who cannot actually metabolize creatine, have been given creatine supplementation for benefit. Let's just look at a couple. There's 7 or 8 different sources or forms of creatine that go into making products. But here's monohydrate versus creatine ethyl ester. This is thought of to be kind of ethyl ester, it's going to be absorbed faster in the gut. It'll be better for the individual because there's no bloating. It's better absorbed in bioavailability. So they gave 30 non-trained subjects 0.3 grams per kg of their fat-free mass, or 20 grams per day for 5 days, followed by, so basically a loading phase, followed by a maintenance dose for 42 days, versus a placebo, creatine monohydrate, creatine ethyl ester. And what they found in looking at the serum creatine content is that by day 6, you can see the creatine monohydrate had a significant increase in day 6, day 27, and even by day 48, those levels still remain pretty constant, where creatine monohydrate had a better increase in serum creatine content than creatine ethyl ester. Also, when we look at muscle total creatine content, same thing by day 6 and day 7, not as significant as the serum, but a little bit, it definitely statistically significant when we look at monohydrate versus ethyl ester. Ethyl ester and placebo were almost identical in most cases, a little bit more significant at day 27 and day 48, but still monohydrate was better overall when we look at muscle creatine content. When we look at the safety of creatine, especially long-term data, 5 years in Division I athletes, looking at a loading dose followed by a maintenance dose, there was no significant effect on liver or kidney function. No long-term side effects in those athletes besides weight gain. There was some dehydration reported only in those athletes who did not consume enough fluids during supplementation. The second long-term study was, 21 months and looked at resistance train, 15 grams for 5 days, and then 5 to 10 grams a day for those 21 months following the training sessions. And 98 athletes, none of those athletes demonstrated any changes in blood or urine markers. Now, when we look at safety for young athletes, that's always been the question is, what about kids under the age of 18? Can they use creatine? And in talking to a lot of these creatine scientists, the answer is yes. But what does the science say? Creatine and muscular dystrophy. 30 boys, Duchenne muscular dystrophy. They were also taking corticosteroids or 50%. 4 months of creatine monohydrate supplementation at 0.1 gram per kg per day. Improvement in hand grip strength, fat-free mass in the creatine monohydrate group, no side effects. Kids with acute lymphoblastic leukemia, 0.1 gram per kg per day for 2 weeks. They did 16 weeks of creatine supplementation, washed out for 6, followed by another 16 weeks of creatine. This would be equivalent to about 7 grams per day for a 150-pound person with no side effects. Creatine and TBI. We talked about TBI. These are kids ages 1 to 18. 39 kids, they gave them a much bigger dose of 0.4 grams per kg per day for 6 months. This would be equivalent to a 27-gram dose of creatine per day for a 150-pound person. So, and the benefits were pretty amazing. They saw benefits in post-traumatic amnesia, duration of intubation, intensive care unit stay, disability, good recovery. So you can see here, all of these outcome measures showed a pretty significant improvement in those outcomes by using creatine supplementation with no side effects. And that you would think in this population that you would see some sort of side effect if there was going to be one, especially giving a higher dose in young infants and children for these outcomes. And then we look at creatine in exercise kids, 16 male swimmers, age is about 16 years of age. Now, this was a short-term study. They only did this for 5 days. They loaded them up, and then they looked at the power output and rebound jumps improved by 20%, no side effects. So I wouldn't think in 5 days we're going to see side effects. It would be nice to see this study go 6 weeks, 12 weeks, 18 weeks, and load them up for 5 days, and then put them on a maintenance dose for, let's say, another 12 weeks, and see, are there any changes in kidney marker function? My answer would be probably not, unless they have a pre-existing condition. We would not see any negative impact on creatinine, BUN, any of those markers that examine kidney function. If you look at this next study on creatine in infants, 34 infants into 2 groups, and this is probably the most interesting study, looking at gestational age of 27 weeks versus 29. It looked at hypoxemia and bradycardia in infants with apnea. So basically it's almost like sleep apnea, and they received oral creatine at 200 milligrams per kg for 2 weeks. It's about 13.6 grams a daily dose if you looked at a 150-pound person. Oral creatine was well tolerated, no side effects noted. So all of the studies we've talked about really have shown no side effects on individuals when you use it the correct way, when you use it right and you monitor it, but also for the right purpose. So when we look at safety, again, in teenage athletes under the age of 18, there's really no study that shows any harmful side effects. Very little is known about long-term creatine supplementation in young athletes. That's the one thing we don't have, or just young individuals besides some of the medical side effects we've looked at here. But also, there's also a lot of misinformation being presented in the athletic and medical community about creatine, that it's harmful, it can be dangerous, when in reality, it can be beneficial if used correctly. Now, there needs to be a lot that goes into these decisions when we're recommending creatine, and we're going to talk about that coming up. First thing is, we have to make sure if someone's going to use creatine, they use a very high quality type, they use a pure type, and they also use a third party tested. Those are really critical components. And there's going to be other things that I'm going to talk about coming up. Here's an example. So raw materials are sourced from different places all across the world for different supplements and different ingredients. Primary sources of creatine supplementation comes from the US, Germany, China. Most of the research that looks at creatine, especially in labs that look at output, have used Alzchem's CreaPure. This is what Dr. Kreider and other scientists have deemed to be the purest form of creatine when it comes to absorption. And monohydrate is still the gold standard. In my discussions with him, monohydrate is still the gold standard when it comes to these raw materials. There's 7 or 8 other sources, but this is still what we want to use. Example of companies using a bunch of different types of creatine in their product: monohydrate, anhydrous, creatine magnesium, phosphate, alpha ketoglutarate, and buffered creatine alkaline. Now, what we don't know is we don't know how much is being used, because this is another example of a proprietary blend. 4 grams, the asterisks are next to each one because they don't want you to know how much is in it. It's not third-party tested. They're not transparent because it's not a good product. But they advertise it on the left as the best creatine. I mean, if you've seen the movie Elf, they had the world's greatest cup of coffee. Well, this company has the world's best creatine. So when we look at young athletes, we have to look at a lot of different things before we just push supplements. I mean, I'm an advocate of supplements when it's the right time. Number one, are they participating in serious competition and competitive training that may benefit from supplementation? How often are they doing this? If they're doing intense lifting once or twice a week, probably creatine supplementation is not warranted. So, if they're lifting 4 or 5 days a week, they got practices 4 or 5 days a week, and they're constantly exhausted, we may want to consider that. But we also want to make sure first they're eating a balanced diet. If they're not eating enough, I had a parent call me. Son was a quarterback. We worked together. We put on about 15 pounds over the summer, but he was still doing so much activity, going back and forth between football, 7-on-7s, and playing JV and summer varsity basketball. It's kind of crazy to look at all the energy expenditure he was doing. He was burning about 5,000 calories a day and only consuming 3. And his dad wanted to know if he should take creatine. And I said, well, it can help, but he's not going to gain weight because he's not eating enough. So calories in and calories out is more important than creatine supplementation when it comes to this. We also want the parents to understand what are the benefits of using this. What does the science say? If a parent is not comfortable, we don't use it. It's that simple. This is not a magic pill. This is not going to get them to the next level. It can help maybe recover. So we need their approval. We also have to make sure quality. It has to be quality. This is the most important thing. As mentioned previously, third-party tested. And we don't want to go over the recommended dosages. I am typically recommending 1 scoop, 5 grams, after a workout. Add it with a smoothie. So blend your smoothie with some protein, some carbohydrate, and then add a little creatine after it, and you're going to get a nice little recovery mechanism. It's not going to be magic. Again, it's not going to happen in a week. It's going to happen over time that we see the benefits of these type of supplements. It's a much safer alternative than steroids and SARMs and other high-risk supplements. And again, it's not a short-term shortcut to success, but a benefit to optimize performance and possibly health. All right, so I'd like to move to omega-3 now. We've talked about creatine. We've talked about, kind of bashed a lot of other supplements, but I want to talk about really, again, creatine. We talked about why I feel it's beneficial. I really want to go into what I consider one of the most important nutrients that's underutilized right now, omega-3 fish oil. Primary forms of omega-3, these are essential fatty acids, EPA and DHA. I always have trouble pronouncing eicosapentaenoic and docosahexaenoic. Don't ask me to ever spell these. I would fail a spelling bee if I got this as a word. But these are 2 essential fatty acids. This means that our body needs these. We cannot get these from food. We cannot get these. Our body does not make it, so we have to get these from food. Sorry about that. They're found in fish, animal products. They're also found in phytoplankton and algae. That's where we get a lot of omega-3. They're also found in plant-based forms too, like flaxseed and chia seeds. But we'll talk about why those are not very beneficial. They are beneficial for health when omega-3 and omega-6 ratio is 1-to-1. So when we have an even balance, the average U.S. diet is 20-to-1. So we have a lot of 6 and not a lot of 3 in our diet. And when we're 1-to-1, healthy blood vessels, lower lipid count, reduce risk for plaque buildup. And also we could lower triglycerides. So great benefits from the health side. I look at this as the Swiss Army knife. It's extremely versatile. We've seen some science on body fat, but I'm not advocating take omega-3 and the body fat drops. There's been some science on lean muscle preservation, cardiovascular protection, cognitive function, ADHD. We'll talk about that today. Inflammation, we'll talk about a little bit about that. We're going to talk a lot about concussion and TBI. And there's been some great research on reducing the outcomes of depression. So this is an extremely versatile nutrient. All right, what are omega-3 fats? I kind of gave you a little bit of a slight overview earlier on what these are, but These are polyunsaturated fatty acids. They're essential in the fact that we need to consume them from the diet. We talked about EPA and DHA. There is a little bit of a difference in regards to benefits. They're both found in the kind of the same food sources. We need EPA in high quantities to really get their benefits. And for DHA, the body converts some back to EPA to keep those levels equal. So we need these in balance. We see sometimes DHA is only given for brain health, but when we have these together, they reduce inflammation, they really work beneficial, and we're going to talk deeply about what the science says. Alpha-linoleic acid, is found in more plant-based. These are plant-based omega-3s, leafy veggies like spinach, flax, chia, canola, walnut, soybean oils even have some omega-3. Now, the only problem is these are short chain, which the body has to convert to EPA and DHA, and those are the two fatty acids that really have the health benefits. Only 1% of these fatty acids are converted into DHA and EPA, so they're really inefficient and they're ineffective. That's why when someone says they're consuming flax and all those other chias, those walnuts, I mean, they're great, but they're not going to give you the benefits that you're going to get from fish. Now, before we get into omega-3, I want to talk about omega-6 because we hear about both of these. These are polyunsaturated fatty acids, just like omega-3. They're essential, so we need to consume them from the diet. And there's three different types: linoleic, arachidonic, and gamma-linoleic. A lot of these come from different cooking oils, soybean. And soybean oil is used in a lot of products today. Well, I'm going to show you that shortly. But you can see here, a lot of different foods have omega-6. They have the same benefits in our diet as omega-3. As you can see here, inflammation, arthritis. But when overconsumed and from the wrong types of foods, processed foods especially, then we have problems. We have the opposite effect. We have more inflammation. And that's kind of what we see in our diet today. So back to that problem, soybean oil. Back in the late 60s, we've seen an increase in soybean oil production. And that really is due to the food supply of wanting to make less expensive ingredients. Instead of using things like olive or avocado oil, which are going to be more expensive and more cardioprotective, we're going to use cheap raw material. And we'll kind of give you some examples of what that looks like shortly. So when we look at where do we get omega-6 fats, we talked about all those different cooking oils, those veggie oils, shortening in margarine, some in chicken, some in things like different types of nuts and eggs, and other miscellaneous items. Again, just another, you can see how much was consumed starting really 100 years ago, less than 0.02 pounds per person per year, and now we're consuming 25 pounds per person. So a quite significant impact of the production of soy oil in the U.S. food supply. And again, that is primarily due to wanting to make less expensive ingredients for bigger profits. Western diet, abundance of omega-6. I mean, look, being from New Orleans, we fry a lot of different foods, whether it's seafood or whether it's whatever it is. We like to fry stuff. It's part of our culture. And hey, all these things can fit in a diet. This is not to say you can't eat these foods. It's just when our diet is composed of fast food and processed carbohydrates on a regular basis, we're going to have a lot of inflammation in the body, and it's going to be hard to reverse that unless we change our diet, eat a lot of foods with omega-3 or supplement. These are just some examples of culprits that do that. And I'm going to kind of show you how to break this down and what food companies are doing when it comes to these type of products. Here's an exact example of, good marketing, but also deceptive marketing at the same time. So here's a brand that we assume is healthy. Look at the label, Smart Balance, omega-3, so they have EPA and DHA and ALA, and also supports healthy cholesterol. So it's not illegal to make those claims. You can make those claims because it has some omega-3, and there's science to support that. Science supports omega-3 intake and healthy cholesterol, but also heart health. But if you look at the ingredient profile, it's a blend of oils, the highest being canola, then palm, then fish, then flax, then olive, then soybean. 6 different oils go into this butter. It's kind of crazy. Now, if this was fish oil, this would not probably be the best tasting butter. No one's going to put butter on their bread or whatever they put it on and have a fishy taste. They're going to be like, what is going on with this? So there's a little bit of fish, just enough to where they give it to make that claim, but they also use some soybean oil in here. There's going to be more omega-6 in here than omega-3. Here's another example, mayo, just traditional mayo, first ingredient, soybean oil. So that's going to be a heavy omega-6 product. Here's another mayo that is an olive oil advertisement. And you can see olive oil is the second ingredient besides water. So the most oil is going to be olive, then canola, then vinegar, and then some soybeans. So they have to mix in some in order to keep the cost down, because if this was a pure olive oil-based mayo, it'd probably be $10 a container instead of $4. All right, there's a really important test that doesn't really get a lot of attention, and it's really probably not super well known just yet, but it's been around a good while, that assesses omega-3 levels in the blood. It's called the omega-3 index. We're going to talk about some science, the benefits, and I think it's going to be something that as athletic trainers, you're going to want to explore in the very near future. This is a simple blood marker, just like cholesterol, done by a finger stick. Looks at the sum of EPA and DHA in the erythrocyte membrane. Now, this is rarely tested by physicians to assess cardiovascular risk. I'm going to show you why this is important, but it's a good predictor of CVD and CHD. If you have a score less than 4%, you are at high risk. If you have a score greater than 8%, you are at lower risk. When we look at the global view, in countries that are in green, these are countries that are in less than 8, that are greater than 8%, that are at low risk. Alaska, Greenland, Japan, Norway, Papua New Guinea, Nigeria, Okinawa. These are all countries that have high intakes of omega-3 that can improve health outcomes. So this looks at really the global survey of DHA and EPA levels in the bloodstream of healthy adults. Now, how does this impact our health, especially looking at cardiovascular disease? And this is why I stress so much the importance of omega-3. Well, we look at the scores of the omega-3 index in coronary heart disease risk, and you can see a score of greater than 8%. If you look at the odds ratio compared to if you are less than 4%, it's a drastic, it cuts by 80%. So a 0.2 odds ratio if you are greater than 8%, and a 1 odds ratio if you are less than 4%. So a significant risk change for coronary heart disease. What about relative risk of sudden cardiac death? Those that are 3.9% or lower, very high relative risk. If you're 7.3% or higher, a very low relative risk. So this is an important marker when we're assessing individuals, to where we want our athletes to be above 8%. Could this prevent cardiac arrest or cardiac death? Maybe. We don't know. Obviously, if there's underlying medical conditions, we don't know if omega-3 is going to be protective for that, because I don't know if that's been studied. But if we look at odds ratio for primary cardiac arrest, just for heart disease in general, look at the significant drop if your levels are above 6.3%. It's almost absent. So we have to really look at this and study this a little bit more, but I think it's something to consider. Now, when we look at, again, we talked about the average American's around 3.6%. Most of us are low. We're less than 4%. Here's a study done in the Journal of Athletic Training, looking at NCAA athletes. And this is out of John Oliver's lab. Big study with a lot of different professionals. But 34% of athletes had an omega-3 index considered high risk of 4%. And 66 were between 4% and 8%. No one had a low risk omega-3 assessment. So we really need to look at this, especially when it comes to concussion, brain health. We saturate the brain. We're going to go into that shortly. All right, so let's talk about omega-3 and brain health. This is going to be a big deal, and a lot of different data that I want to kind of share with you guys. First of all, the brain is 60% fat. 25% of that fat is DHA, one of these important essential fatty acids I've been talking about, as well as AA and other different types of fatty acids. But DHA is that critical component fatty acid of the brain. If you look at the neuroprotective effects of omega-3, this is really what it promotes: neuronal cell survival, reduction of apoptosis or cell death, reduces the oxidative stress and gives more plasticity to the brain, and also neurotransmission. So many different benefits, very versatile when it comes to looking at traumatic brain injury. Let's just look at what does the research say in early childhood development. Moms who ate fish 4 times a week during their pregnancy had babies with a higher developmental score at 18 months. Children whose moms received at least 2 grams of combined DHA and EPA at 4 years of age had significantly higher IQ tests. So that just means prior to having a baby or at pregnancy, it's good to start consuming omega-3. That's why DHA is put in some multivitamins. It's just not put much. It's not much. It's not nearly what these people need. They're getting very low dosages, so we're not getting the benefit. Let's shift to autism. 12-month randomized controlled trial. Children with and adults with autism spectrum disorder who received a multi-nutrient supplement, and it really was dose dependent based on the size of that individual. A gram for those that were 30 to 50 pounds, a gram and a half from 51 to 100, and if you're over 100 pounds, about 2 grams per day. And every single marker of autism performance, from autism symptoms, functionality. You can see here all these different autistic scores. Now, I'm not an expert in this study, or in this type of work, but you can see the treatment groups showed an increase compared to non-treatment group. That is quite significant in every single outcome. So, parents of kids with autism, this is something they need to consider, is saturating the brain with omega-3. Let's move to ADD and ADHD. I have a 9-year-old with ADD and ADHD. I've been giving her fish oil since she was 3 months old. I stopped for a while. It wasn't consistent, and I kind of regret that. Now, I'm not saying it would have prevented this. I think some cases. But what we do is we have incredible science to look at 16 randomized controlled trials, over 1,500 kids up to 18 with ADHD, and they had it at baseline. They were given omega-3 supplements and a combination of EPA, DHA, and GLA. And then 13 of the 16 studies showed favorable benefits on those symptoms. Omega-3 lowered the dose of traditional medicine and proved to be an effective adjunct therapy. When you look at those markers, when you look at the markers of ADD and ADHD, the supplementation demonstrated improvements in hyperactivity, impulsivity, attention, visual learning, word reading, and working short-term memory. We talked about depression earlier, the impact it has. Here's kind of just an idea of when you look at depression symptoms and fish consumption. This is just fish consumption, not supplementation. Japan, Korea, Taiwan, depressive states very, very low, or a lot lower, as you can see, the 1s, the 2s, the prevalence per people. Countries with low omega-3 intake, New Zealand, Canada, United States, we have a higher depression rate. So there is some correlation, older study from Lancet in 98, but there's been a lot more research coming out that has come out and have shown the same type of outcomes. All right, what's the current treatment for TBI and concussion? Well, there's other things, new research has shown exercise and other benefits, but remove from play, physical and cognitive rest, progressive return to play, medications. Nothing addresses the brain itself. Nothing really focuses on neuroprotection, neuroinflammation, regeneration following TBI. There may have been some things that have changed, but according to Michael Lewis, in looking at what has been done and talking to athletic trainer friends, there are new studies and new things to talk about, ways to where we don't put them in just a dark room, and we try to keep them to where they get their body active again. I know there's some new data to show that, but what is being done to feed the brain to reduce inflammation? Here's kind of where it all started. This teenager, Dr. Julian Bales' work, going way back to where they had a teenager with a severe TBI in an auto accident. And after that auto accident, this kid was pretty much thought to be brain dead. Glasgow score of 3, right subdural and small temporal hematoma, believed to be in a vegetated state, placed on a trach and a peg tube, and started enteral feedings by day 10, was not given the weekend to live. So they you know what? Let's just try this and see what happens. They gave them 16.4 grams of combined EPA and DHA. Now that's usually 8 times, 9 times the recommended dosage. Put it in this peg tube. In 10 days, weaned off the vent and began rehabilitation 3 days later. So this is an N of 1. We get it. It's not a controlled study. It's just like, let's do something and see what happens. Well, Dr. Bales and his team also did this again. They had a mining accident, 14 people, 13 of them died. 1 person suffered that was still alive from respiratory distress due to elevated CO levels, lung collapse, unresponsive, comatose. I think also went into cardiac arrest, given high doses of fish oil through peg tube, had full recovery. Another N equals 1. So this is really kind of where it all started, to where let's start exploring maybe feeding the brain with omega-3. What happens when we feed the brain? Well, a couple of years ago, John Oliver did an incredible study looking at football players, but really looked at the course of action and what happens to the brain over the course of time. And what John looked at was, he looked at the effect of DHA supplementation on neurofilament light. Ironically, NFL. This looks at axonal injury. randomized blind placebo-controlled study, 81 Division I athletes, and they gave them 2 grams, 4 grams, 6 grams of DHA or corn oil as the placebo. And they looked at almost the course of the entire season. What happens to neurofilament light over the course of a season? It's really interesting to kind of see starters versus non-starters. Look at the impact of the season versus neurofilament light. They looked at preseason, summer conditioning, fall, and then the season. And as the season progressed, the impact on brain damage and brain injury increased. Those that did not get much activity, you can see, did not have really hardly any impact on their brain. Now let's look and see what happens when they gave them treatment. The treatment group saw a significant reduction in neurofilament light. That is, severely impacted on if we saturate the brain, do we improve outcomes? Do we reduce the severity on neuroinflammation? And the answer is yes. Now, what's going to be most interesting is going to be actually what the dosage was. When you look at all the different dosages, I would have predicted, based on some of the things we've seen, is higher dosages would have been better. But 2 grams and 6 grams were actually almost identical, to where just 2 grams had the best outcome. 4 grams had the worst outcome. And we don't know really why. I don't know if Dr. Oliver and his team knows why, but this was kind of an impressive that, hey, just a couple of grams a day, can help saturate the brain and maybe help the brain recover and prevent the impact of neurofilament light and axonal injury over the body. So protocol for athletes, going back to Dr. Michael Lewis, I was fortunate to speak with him at a conference several years ago, and in his work, he still believes, and if you go to the Brain Health Education Network, he's got a lot of great resources on this. But, if an athlete has severe TBI, you really want to start them on a higher dose of 9 to 12 grams 1 to 2 weeks post-concussion, and then there's a chance you wean them down. Start at 9 grams, 6 grams week 2, 3 grams week 3, and keep them there. If the symptoms do not subside, try to keep them at a higher dose. So general health, 2 to 3 grams per day. That's really what we're focusing on. And really for anyone starting out, don't go over 4 grams. Usually 2 to 4 grams, 3 grams. 3 grams is a good dose. That's going to raise your omega-3 index. That's going to improve outcomes. Most people are supplementing, 800 milligrams. They're not even getting a gram a day in a lot of their products. When we look at certified for sport, and I'm not going to go into all the different forms of fish oil, but there's 3 different types. We're not going to break down the science on all of those just for time purposes, but most fish oil is in the ethyl ester form. That's going to be 99% of the fish oils. Just about everything at a supermarket, a grocery store, a pharmacy, they're not going to have triglyceride-based fish oil. Don't take store-based fish oil. Don't go to your supplement store, because they're not going to have good fish oil. It's just the case. It's oxidized. If you have fish burps, it's bad fish oil. It's not good. It's not going to really be any benefit. So a couple of companies I like personally, as I said, I am on the scientific advisory board for Nordic, but they are a fish oil company. I'm not paid by them by any means. But they do have third-party tested, and that's the most important thing for your athletes, is to get a third-party certified product. NSF for Sport, you can see here, Ultimate Omega Sport, and then Clean Omega. This is a triglyceride-based fish oil. These are fish oils that have the best bioavailability and the best absorption. These are the only 2 triglyceride-based fish oils that are third-party tested. That's why they are put on this slide deck. So if you need banned substance-free, these are the gold standard when it comes, and they're both triglyceride-based. There's only a handful of companies that use triglyceride-based fish oil. How do you know if you're taking dirty supplements? We're going to kind of get into the root of this presentation in steroid about it, NSF. So if your athletes are going to use any product, protein, creatine, whatever it is, make sure they focus on third-party certification only. If they go to nsfsport.com, you can also download the app into the phone, and you just search by product. So if you want to search by creatine, if you want to search by anything, you can pull the product up, and then you can actually look at the brands that actually certify. That doesn't mean the product's going to work. It doesn't mean it's effective dose. It just means it's certified and it's clean and there's no banned substances. So let's kind of get into the nuts and bolts of really the steroid side. What are anabolic steroids? And let's talk about the side effects of these. Knows what testosterone is. I know you guys know what this is. Natural hormone in the human body, produced for male sex hormone, puberty, growth, all the different changes that we see over time when a guy changes his voice, etc. That's what testosterone does. All right, when we look at anabolic androgenic steroids, we look at really the two physical properties and two outcomes: anabolic, muscle building; androgenic, increased male characteristics. So when we take these drugs, we have a couple of different purposes, but most people are taking these to change physical appearance, and that's not really the purpose of why we want to take these drugs. Now, these are not the same as corticosteroids, which are commonly used to treat things like asthma, arthritis, and skin rash. These are drugs that athletes and individuals are using to change their physical characteristics and especially physical outcomes and physique. Now, they do have some steroids developed for medical reasons. We look at steroid hormone deficiency, puberty, cancer, AIDS, severe illness, muscle wasting conditions. There are reasons why individuals are prescribed steroids from their doctor. Now, they should not be used, again, to get bigger, stronger, faster, or to bodybuild. But there are over 120 different types of pharmaceutical-grade steroids that are being used now in the medical science for those specific medical-based reasons. Methods of use. Commonly used today, we see pills, cream, lotion, patches, but the most commonly used are going to still be the needle and syringe method. Now, let's talk about what are actually our youth taking. Most people assume, our youth is going to be using designer-based steroids, what athletes are using in regards to some of these things cost thousands and thousands of dollars per month to use. Our youths, are they really taking what high-performance athletes are getting their hands on? Now, when we look at where these drugs come from, these are street-based steroids made in home-based labs. A lot of these raw materials are imported from China, and when we look at the powder and how they mix these agents, they are mixed with anything from baby oil, Wesson oil, cooking oils, even motor oil, and you can actually see that on the slide correctly. That is horse urine. Now, I don't know from personal experience that I've never touched horse urine. I just hear it's a thickening agent. When you require these thickening agents, it makes the finished product, and it makes the finished product look more authentic. Come from and where they're made. Really, these are provided to home-based labs, and they are provided in the same type of facilities that have very poor quality control, no regulations, and as you can see, there's not a lot of good quality handling and safe handling of these raw materials. Can you spot the motorbike in the back? That does not happen in U.S.-based manufacturing facilities that make dietary supplements. There is significant quality control. I've had a chance to visit some of these raw material manufacturing facilities, and it looks nothing like this. Now, when you look at the filtration, when they actually have to filter these products, they come from the same warehouses. And as you can see, they're not cleaned. There's no quality control. There's no regulation in really where these raw materials are coming from and how they're made. But you can see here just the cleanliness and the poor quality of these facilities. Pest control, same manufacturing facilities or same warehouses where these raw materials and drugs are manufactured. Again, you can look at the quality control and the poor quality control and the type of outcomes they get. And these are pictures actually that were sent to us by the DEA when it looks at a drug bust of what they've happened and taking pictures of these facilities. Packaging area, same thing. These same warehouses. If you go again into a dietary supplement raw material facility that has all the testing, all the manufacturing processes in place, follow good handling, good manufacturing practices, certified. Everything is neatly organized in a certain order. So this comes from those same Chinese-based facilities and warehouses that ship these products, and you can see here they just kind of throw this stuff up. There's no specific structure. Some extras found in some of these product lots, you can see from metal, wire, wood, glass, and string. So a lot of different outcomes due to that great filtration system we saw earlier. Now, when you look at a lot of the final preparation, these are actually pictures, again, from Drug Bust. These are not, this looks like a home, these are home-based labs that not only are manufacturing steroids, but manufacturing other drugs. So if we look at, what's interesting is when you look at these facilities or these homes where we're making these drugs out of our house compared to what the finished product is, it's quite interesting to see. And if you look at the top right, you would think those vials and those finished products are coming from a pharmacy or a pharmaceutical-based facility when they're actually being manufactured in someone's home. So this is what we're dealing with. These are the local labs we're fighting against and battling that are distributing these drugs to our youth as well as to our adult influencers. Some of you guys may recall years ago there was a recall on toys. especially from Mattel. Kids were putting some of these toys in their mouth, and they found lead, mercury, zinc, tin, and arsenic, and 21% of those steroids from these underground labs were also contaminated, have been tested positive for the same type of toxic heavy metals found in these toys. Where do they come from? Same base warehouses that are manufacturing these raw materials. How much are users taking? This is always quite interesting to really see the amount of steroids that are being injected and consumed by individuals. We show this, we never show this to our youth, we show this only to our adult population. Normal medical daily dose, if you're getting a prescription from a doctor, is 5 to 10 milligrams a day, and they're consumed in different ways. Obviously, stacking, cycling, pyramiding are all different ways that people can use steroids. And here's kind of an example 12-week cycle that expands. You can see at the top on Monday, it's just 100 milligrams of Primobolan Depot, and then they add on Wednesday, they add some Deca, and then on Monday they add a little Winstrol with the Primobolan, and then so it's basically a 12-week cycle that expands the use. By Friday they're taking 3 to 4 different types of steroids, and as they get to the end of their cycle, they're starting to take HCG to kind of help them wean off of some of the side effects that they're seeing. So as you can see, a very expanded use where in week 6 and 7, they're doing 4 days a week of injecting themselves with a compounded approach to steroids. And this is all found online. That's the scary part about a lot of this is advertised online for a lot of our youth to get an understanding of how to use these drugs. Now, again, when you look at medical, 5 to 10 milligrams, where the long-term steroid user is taking 3,000 milligrams per week. Now, as we talked about, these things have easy access. The steroid supermarket, all of these different media outlets are advertising or have been advertisement for steroid use and purchasing. If you look at just steroids for sale, millions and millions of hits have been published on these type of products, and I think these hits are actually higher now. Some of this is data from 2019. If we look at today's data, we're going to see a lot more hits. If you look at steroids for sale, buy steroids online, 87 of the top 10 direct consumer websites sell commonly used forms of anabolic steroids. So this is kind of scary, especially, I have a 9-year-old that they can get access to anything pretty quickly. Not that she's looking for that, but you never know, one day they may be looking for different things to change their physique and appearance. These are just some examples of what those advertisements look like. So you can see buysteroids.org. If you look at the bottom right, you will see on our page, we were advertising in 2019 or marketing our annual gala. Well, this company, Facebook knows what we do. They are, and you can see there's a market for buying steroids on an e-commerce website to the right of that. So it's quite interesting to see, just based on some algorithms and based on what a company does. I mean, if I type in on my phone a supplement company, the next time I go to Facebook, it's going to be advertising on my page. How much do steroids cost? I mean, usually, this kind of makes people think students can't afford steroids, and that's not necessarily the case. Steroids are actually quite inexpensive, and some of these kids have jobs, and it's really easy for them to get access to some of these street drugs. Elite athletes are spending thousands per month for designer-based steroids, but young individuals can't afford the same type of drugs that role models are taking. Who uses? Most people, you would look at Taylor and think, he doesn't look like the typical user, right? He looks like just an everyday kid. And that's the one thing that we struggle with, is we're not looking for users in the settings, in the school settings. We're not typically looking at individuals that are using steroids. Who use steroids? And when we look at who those users might be, there's a couple of different types. There's boys, there's athletes and mirror athletes. The athletes are obviously the ones that may be using to get bigger, stronger, faster. The mirror athletes have a different approach. They have no desire to change their physical performance when they're really strictly looking at changing physique. 80% of steroid users, especially young athletes, have no desire to compete in athletics, and that's from Dr. Pope's work when he's in his book, Hidden in Plain Sight. Who uses APEDs, I mean, females are the fastest growing user. Young high school girls right now have a desire to use because they want to change something, and it's not always athletic performance based. More than 1 in 20 of these high school girls have already admitted to using anabolic steroids, and these numbers are starting to increase based on the data that we're seeing. Why do students want to use? The number one reason based on data is physical appearance. Somebody somewhere is telling them they don't look a certain way, they don't look the right way, or they want to feel better about themselves. So physical appearance is driving that. Athletic performance comes in third, and then other outcomes like fighting better and treating illnesses, round out the top 5. Most people don't realize there's over 2 million high school, middle school students that have admitted to using. Then the numbers may be much higher for those that are unknowingly ingesting steroids versus or via supplements. And the median age usually comes at 15. This is from the Partnership of Drug-Free Kids study, as well as some data from the Fenway Institute of Harvard in Boston. Why? What's driving the use and what's driving the need to use these drugs? Role models. We have individuals in all different means of entertainment that have certain physiques that we idol. Whether it's athletics, whether it's whether it's the movies, no matter what it is. If we have certain individuals we look up and they have certain body types based on, and we're not saying these all are individuals in this picture that use, but at the same time there are some questions about individuals that we idolize and look at and say, oh, can that body be obtained without the use of appearance and performance enhancing substances? Models in all sports. I mean, all different sports. These are all individuals that have used drugs to compete at a level, whether it's in bodybuilding or whether it's in cycling or basketball. All these individuals have tested positive for banned substances. So when we look at, let's shift to media and advertisements. This is a really big market. When I was young, I remember I loved Muscle and Fitness and loved some of these magazines because I thought I could look like the guy on the cover and didn't realize really what I had to do to get there. I thought just lifting weights and eating is going to get me to look like the Incredible Hulk. That's what I always wanted to look like. So, but what's interesting is these two magazines have similar marketing ads. 28 days to get ripped in the male, Muscle and Fitness, 28 days for amazing abs in the Oxygen magazine for female. So a lot of false advertisement when it comes to these type of programs to get you to open up and really see inside of these magazines. There's a lot of advertisement for supplements. There's advertisement for certain types of illegal substances. And even in the back of these magazines, there's advertisements from cosmetic surgery to correct gynecomastia. So they know who they're marketing to and what the outcomes are. Here's just an example of kind of steroids being portrayed as okay or being portrayed in a positive light. If you look at the detour bar on the top left that says Snickers on steroids. I mean, steroids is a word used loosely. I used to use it before I joined this organization, not thinking anything of it, but just thinking it means bigger. But when you look at this, it kind of creates the mindset that it's okay. Now, let's change that detour bar ad and say Snickers on crack. That would be a completely different outcome. Parents, adults, I mean, I have a 9-year-old. I would do the same thing. Go, wait a minute, what is this? How can this be allowed? But steroids, we don't look at that in the negative light. We look at it more in a positive light. All right, and finally, body image. This is the number one driver, the number one reason people are using these type of drugs. We start them young. I mean, you look at some of these Halloween costumes, we just kind of get people thinking at a young age, it's okay, and this is kind of where we should be with our body. It's not acceptable to be overweight. It's not acceptable to have a higher body fat. It's only acceptable to be lean and strong. I remember growing up, these were, this is what Superman and Batman looked like to me. Just average guys, maybe a couple of people you'd see eating at the Waffle House. Nobody that's abnormal in size. But today it's a lot different. Our kids see completely different body types for our superheroes, which makes them think, this is really the norm. This is what I should be looking like. And it kind of drives that desire to look like this. Again, looking back at Halloween costumes, there's a lot of different options that all have those six-pack abs, lean muscle figure, lean physique. Go back to toys. Back in 1970, poor G.I. Joe over there was connected with screws and looked like he missed a couple of meals every day. Whereas 30 years later, G.I. Joe is all jacked up. In today's G.I. Joe, it looks like he can eat G.I. Joe from 1970. So it's a completely different figure and composition of those animals. I mean, if you look at G.I. Joe today, one arm is bigger than almost the entire torso of G.I. Joe from 1970. Ladies back in the day, my mom and grandparents, I even saw these magazines. My mom owned a hair salon, so I saw Cosmopolitan all the time. It was just, didn't think anything of it, just elegant, pretty ladies on the cover. Today, girls see a completely different body image when they're looking at females, and it's a big concern because, it's portraying kind of that sex appeal, that desire to, do you need to wear a lot of clothes? Do you have to have a certain body type? You don't see, or you haven't seen for a long time is, an out of shape person or an overweight woman. We're starting to see a little bit more of a shift in that, but for the most part, the portrayal of females has been just lean, sexy, and strong. And that's fine. It's fine to have that, but there needs to be some balance to where that's not the only body image we think everybody has to look like. Back in the early days of wrestling, when I went to wrestling matches, these were the guys that I used to see beating the world out of each other, and it was great because they weren't getting paid much, and it was pretty authentic. These guys are jumping off ropes and bloody, and it was kind of cool to see, the pure raw talent in wrestling. Today, it's a completely different story. It's a business. There's a lot of money to be made. You look at somebody like Brock Lesnar. He's tested positive twice for performance-enhancing drugs in the UFC. And we know a lot of these body types are pretty impossible to achieve without the use of performance-enhancing drugs. Finally is why not use? What are the reasons for not using these type of drugs? We know, number one, it's kind of the least important, they're banned in competition. And they're banned in competition for a specific reason because they know the long-term effects of these drugs are quite significant. It's also cheating. It changes the fundamental value and competitiveness of the game. They're illegal, so you will be caught with a felony if you're selling, distributing, or manufacturing, and they're banned for your protection. We know young individuals that start at a young age using steroids, they have a greater potential to do more harm than if we started later in life. This is not encouraging anyone to use at any time, but the damage that can be done at a young age significantly outweighs starting at a later part in your life. All right, so let's talk about one of the first side effects of hypogonadism, and this is a dysfunctional activity of gonads, the male testes, the female ovaries, when we know steroid use can lead to a suppression of the hypothalamic pituitary, which results in a low androgen production in males and creates hypoestrogenism in females, or low estrogen levels. Side effects are going to be low T levels or low testosterone levels, diminished production of sex hormones, low or absent libido or sex drive, because the body now is no longer naturally producing. For years, it's been getting it exogenously, so it thinks it's going to continue to get that. And again, eventually could lead to depression, and we've kind of seen some of those outcomes. Long-term use can lead to permanent suppression of testosterone or estrogen, which is going to impact those symptoms or side effects. Cardiovascular system, we've got a lot of data to show long-term health. So I'm going to show you some slides coming up shortly on impact of that. But really, the biggest thing is it really just weakens the ability of the body's heart to pump. It makes the left ventricle weak, causes more water and salt retention, which increases blood pressure, and makes the heart pump harder because it's getting larger over the course of time. Increases cholesterol and triglycerides, and also blood clotting disorder. So a lot of research, especially some newer data a couple of years ago in the Journal of Circulation, to kind of demonstrate the impact of ejection fraction. Here's kind of study number one that looks at steroids and cardiotoxicity of the heart, looking at long-term steroid use in cardiac function and plaque formation. 140 experienced male weightlifters between 34 and 54, looked at 86 subjects who use steroids for greater than 2 years versus non-steroid users. And the results are basically exhibited higher left ventricular mass and heart size, exhibited thicker left ventricular walls. 71% of steroid users had below normal ejection fraction or heart pumping function, and they also showed significantly higher plaque volume. So this is that study that looked at cardiovascular toxicity from those steroid users. Here's just the outcomes from ejection fraction. You can see all users on the left in the top looking at left ventricular ejection fraction function. If those that were on the drug, you can see a significant drop in ejection fraction as low as 20%, which is almost not functioning at all, to where those off the drug had a baseline of 50 to 65%, which is a great ejection fraction. And again, if we look at early diastolic left ventricular tissue velocity on the bottom in B. You can see same thing. Those are on the drug, decrease in anabolic steroid users versus those not on the drug had a significant improvement in outcomes. If we look at a couple of different outcomes, plaque volume, steroid users had coronary artery plaque volume began to significantly decrease, and that is something we do not want to see, is that plaque volume over the course of time actually increasing. If you look at those that were percent using steroids, they had a higher plaque volume of greater than 500%. That is not what we want to see when it comes to coronary artery plaque volume. If we look at number of deceased coronary artery segments, obviously significantly higher in users. From baseline, you can see at each number of disease segment, we saw really those that were had the highest income with those that were using versus not. Coronary artery calcium score, bottom right, this is an indication of cardiovascular disease. Those that had the highest scores were also steroid users. I thought this was interesting as artery plaque volume. You can kind of see the years of use versus the amount of plaque volume. And as you can see, there's a correlation between years of use, 10, 15, 20 years with a higher plaque volume versus those that were only using for a short period of time. Some had no increase, but the increase really was a cumulative effect of years of use. You can see that increase in baseline over the course of time. So as we know, enlarged heart, that's kind of one of the biggest side effects. You can see this, the size here, and it really increases the thickening of the heart and makes it a lot less blood flow for that individual. It makes it a little bit more difficult for that individual as well to pump blood, makes the heart thicker, and eventually leads to cardiomyopathy and cardiac failure. Here's just an example of a picture of a diseased heart from a 22-year-old bodybuilder that started at a young age. You can see the plaque buildup and fat around the heart and the artery. Some of the other physical dangers you can see is acne. Acne is kind of one of the first side effects we see. This is a picture of an individual that obviously has a severe case of acne induced from anabolic steroid use, which led to a lot of lesions on the body from excessive use, and that is the same individual over the course of time. And you can see just how the person's body has changed. Now, this is a severe case. This doesn't happen in typical users, but if we use from over a course of time, this can cause a significant buildup and cause significant side effects when it comes to oily skin, acne, and really this is something as athletic trainers to really identify in your kids. If you're starting to see some of these outcomes, we're going to talk about really active monitoring shortly on how to monitor this over the course of time. Males' side effects, again, premature balding, testicular atrophy, low sperm count. We've talked about that. Birth defects, painful erections, grow breasts. These are all different side effects from gynecomastia infection that males will see. We are not absent for females to have similar type of side effects from male pattern balding. They actually have body hair in certain places like their beard, deepened voice, breast shrinkage, abnormal menstrual cycles, all significant outcomes from long-term use of using these type of drugs. Basically, steroids impact the entire organ system, whether it's GI, musculoskeletal, kidneys, hypertension. All of these different impacts of steroid use can impact every organ in the body. And finally, you can see is this users can become addicted. That is one of the psychological effects that we're going to discuss shortly. And this is really what impacted Taylor, was the psychological effects. We only look at physical appearance, and we don't think about mentally what happens to an individual when they start manipulating hormones in the body. This looked at steroids and brain toxicity and cognitive decline. And they looked at 31 steroid users versus 13 non-steroid users from 29 to 55, and looked at 5 cognitive tests to evaluate memory, learning, reaction time, and visual processes. And the outcome was steroid users showed a significant reduction in visual perception. They also underperformed on pattern recognition tests, but there was no difference in response speed, sustained attention, and verbal memory. So we've heard of roid rage. We know in Taylor's case, this is one of the first signs where his parents were kind of knew something was wrong and had to act and didn't know what was going on. And, in Taylor's case, it's not always that outcome, but at the same time, there's a lot of other significant outcomes that we've seen that led to other things that led to death. Severe depression, alcohol dependence, drug use. We start on these drugs, and eventually it could lead to a bigger, stronger reliance. When we get off these drugs, we become dependent on other drugs for a variety of different reasons. And a lot of times that's due to the depression. The depression can lead to suicide. It could also create us and reach out for other drugs to help us mask those problems. So it has those significant mind-altering effects. You're altering your body's ability to naturally produce hormones that are controlled by the body. How do we address the problem? And this is kind of a big thing that, why we're here today and I'm presenting to you guys. I know it's a virtual presentation, a little bit different, but we need more education. Guys are the key. 85% of young people have never had any kind of talk with a parent or coach or anything about performance-enhancing drugs. These kids know drugs are bad, but we don't think about these type of drugs. These are not drugs people get together on the weekends and party with. No one says, let's say we're going to have a steroid party and we're going to inject people. That does not happen. These are secretive type drugs. And that's why it's rarely discussed, because individuals don't want them to know that they're using these. They want them to feel it's done naturally. So education is the key. Prevention is the best. Most counter the education they're receiving at the local gym. They are being educated in the gyms. There are people in these gyms that are pushing these type of information, and I hear it all the time from these facilities. So we have to think beyond athletics. We have to begin this in the middle and high schools and start young. What can athletic trainers do for active monitoring? Well, we have to look for signs and symptoms in your athletes. Do they have acne? Do we see rapid weight gain in strength, rapid lean muscle growth? Do we see any behavior changes? Have you noticed something about that athlete that you haven't seen in a while? It's like, wow, this is not the same athlete. Something is going on over the course of time, and we need to change that. Physical appearance, are they a little bit more aggressive, short temper? So look for some of these signs and symptoms. This is a great way to truly monitor this. We've seen research to show active monitoring works. It can impact, and you can intervene and make sure we get these athletes the right help and talk to their parents and see how we can really help them overcome some of these challenges. That's why we do these education programs. We have a lot of opportunities to come in schools. We educate kids year-round on this, coaches, parents, to make sure they understand the severity of this issue. We do that through different multiple assembly programs, just like we're doing here. Obviously, we do these virtually now as well. We have been in some of the biggest colleges, high schools, and conferences across the country to deliver our message. Finally, we have what's called the All Me League. This is an opportunity for our professional players, especially our Major League Baseball partnership, where players have stepped up to compete and live without the use of performance-enhancing drugs. So when you see them in our shirt or anything that says All Me, it means they are training hard, playing fair, and eating right, and doing it without the use of performance-enhancing drugs. They're doing it the right way. They don't need drugs to compete. And this is one of the things with Major League Baseball and their stance to fight against performance-enhancing drug use. I want to thank you guys for your time. Obviously, we had that first slide. If you need to reach us at taylorhooton.org, you can reach us. In the first slide or second slide, we talked about emailing the OATA if you have questions regarding this presentation, and they will get those to me, and I'll be happy to answer those. So thank you guys for the time. Really excited about the new format, and hopefully this was an educational session for you guys. Have a great day.